Ahoy, Lisa.
Hey, Bach.
Welcome everyone to OI Fight Club, or a free association conversation between Lisa Grove and myself, Dr. Bach. We're both organic intelligence coaches. We help people reduce suffering and increase capacity to handle more in life with ease using the protocols of organic intelligence. Links will be in the description to learn more about each of us. Lisa is a longtime client of mine and was a NASA spacecraft systems engineer, a rocket scientist who worked on missions like the Galileo spacecraft to Jupiter and the Hubble Space Telescope. And she has a master's in social work. You can reach out to Lisa for OI sessions. Strongly recommended. Today, our topic is EMDR versus organic intelligence. I'm going to leave it when I hand things over to Lisa. I'll leave it to her to explain the acronym because I don't get pleasure from trying to remember the words except for I. And so I'll leave it to Lisa for that. Last week, we did cognitive behavioral therapy, CBT versus organic intelligence, OI, CBT, the Goliath of the therapy world. EMDR is a Goliath within the trauma therapy world. I've never been, just a few comments before I hand to Lisa. I've never been to an EMDR session as client, though a while back I had a therapist recommend EMDR to me. Actually, Lisa, I was actually attacked by a dog. Last week we were discussing the example of being attacked by a dog and fearing dogs. How would CBT approach? How would OI? And I got attacked by a pit bull and bled on my driving to the ER. And my therapist later recommended EMDR to resolve the trauma, but I don't think I had any, so I never did it. Um, just a
Certainly,
story.
the example last week didn't bother you, or
I'm
didn't
good.
appear.
Oh, I'm good. Thank you. Thank you for the concern. Um, Lisa has a lot of experience with EMDR as client and has done a lot of thinking about it. So naturally, we're doing a session on EMDR vis-a-vis organic intelligence. So Lisa, could you briefly intro EMDR to us? And I know I keep asking you to repeat, explain OI, but just explain OI a little bit after
Sure.
EMDR, and then get into free association, your experiences with EMDR and how OI differs, and then we'll go from there, see what happens.
Okay. So, the basic premise scientifically with EMDR is that when a traumatic experience happens, sometimes the brain doesn't finish processing all the pieces. And those halfway or one third of the way processed pieces stick around and sometimes fire off. So, if you've had trauma in your past, all of a sudden you might feel terror and be hiding in the corner because one of those fragments fired off and your whole body thinks that fragment is happening now. So the trauma can be pretty disruptive in that way. So
Hmm.
EMDR helps the brain finish that stalled process.
Okay.
So the EMDR has a bilateral stimulation, meaning when I did EMDR a couple decades ago, I had to watch a little light that went this way and that way and this way and that way. So my eyes were going left, left, right. And what that does is it stimulates one half of the brain and then the other half of the brain. And the memory got integrated that way. The more modern impression now is the bilateral stimulation is a way to give the brain enough rhythm and stability while it's doing what it needs to, staying connected to the present, touching that old memory without getting swallowed up by it, and reorganizing the memory so now it becomes past tense instead of now. So the rhythm is more like giving the brain a heartbeat to concentrate on while it's doing its fixing while the therapist is helping. So EMDR borrows from what the brain does naturally in REM sleep, where left-right activity and rhythmic movements and emotional integration all happen at the same time. And that's exactly what you need when you're processing a memory fragment that isn't connected to anything. So EMDR aims to give the memory that once yanked you into panic or dissociation a memory you can remember without being thrown off your feet. The explosive charge dissolves and the body stops reacting as if the danger is right now. So people often say, it's still true, but it just doesn't feel like it's happening to me anymore. Or the memory is still there, but it's now quiet. So it doesn't take the memory away, but it puts it in the place the brain would have put it during the traumatic experience if the whole system hadn't been too overwhelmed and the brain hadn't had to take care of other things and never got to get back to the memory. So it doesn't erase anything. It's just giving the nervous system a chance to complete what it didn't get to finish. So the past stops rudely interrupting into the present. On the other hand, organic intelligence starts with the premise that the nervous system isn't failing. It's overwhelmed, overworked, and trying to protect you with the only patterns it had available at that time. So the sudden overwhelm and dissociation aren't because of the memory fragment. They're because the system hasn't yet found the resources to finish processing that. It got stuck before it found the resources in the trauma. So OI doesn't try to complete the stalled memory. It tries to restore the conditions under which the nervous system can finally do that itself. So with EMDR, it's helping the brain do this thing. And with OI, it's let's find the conditions where the brain can do that without us helping it. So EMDR says, what experience never finished processing? OI says, what support did the system not yet have? And then it gives that support in tiny, safe, body-led doses until the system remembers how to settle on its own.
Let me know when I can.
Yeah, just a little more.
Okay, yeah.
So for OI, a dysregulated nervous system doesn't heal by going towards something that's activation, even carefully, like an old memory. It heals by regaining access to its own built-in stability first. And then it goes off and heals the activated stuff. But OI helps the nervous system regain its stability first. And then the system spontaneously finishes what it needed to be doing back then when it got overwhelmed. Once it gets the resources it needs, the body stops bracing, the system starts looking to the present instead of always flashing back into the past. Small waves of settling show up on their own. The background hum of threat gets quieter, capacity grows, and ease comes back. Because OI doesn't ask the system to do anything difficult, there's no confronting, no revisiting, no activating. The changes often feel natural, almost ordinary, like, well, where did that come from? Because they don't happen right there in the session. What happens in the session is that the nervous system finds more stable ground. And then the client goes off and their nervous system is taking care of things in the background. So people say, I didn't try to shift anything, something just happened. Or my system finally remembers how to be itself. So EMDR focuses on repairing what was overwhelming in the past. OI focuses on strengthening what already works right now, so the rest can reorganize without effort. That's the basis.
Thank you. I wish I had taken notes, and while you were speaking, I was just to share an interesting thing about my experience. I wanted to orient to what you were saying in the moment and to you. Also, part of me wanted to take notes, and I didn't know which to do, and I just decided to orient. But I have some memory of what I wanted to engage with you.
Okay.
So thank you for
Well,
that.
you're welcome. And I've written it down. You can have it later if you want it.
Oh yeah, nice. Maybe, I mean, going forward, maybe I'll just say, can you send me your notes early so I can do some prep? But whatever, we're here. Or free association.
Yeah.
So I have a big picture. Okay, I have several things. I have a big picture question first. So we're doing EMDR versus organic intelligence. One of the points you made in the beginning was, according to EMDR, a trauma happens and you have a memory that wasn't processed, that didn't complete processing, and EMDR, the goal is to complete the processing, right? That was in the opening
Right.
statement, right?
EMDR gives with the bilateral touch or eye movement or sound, gives the brain something rhythmic to focus on.
Yeah,
Takes the memory and pulls it in, takes the part that we're going to work on today, which we're not, but if you're the therapist, brings it out, holds it in mind while the brain is getting that regulating rhythm.
let me interrupt. Let me take control of
Yeah.
it. Yeah, okay. So thank you. I'll get to that.
Okay, sorry.
You were getting into the mechanism of EMDR, which I appreciate. I wanted to ask a bigger picture question first, which was the premise that there's an unprocessed memory that needs to be processed for healing. Is that shared by, in general, by trauma therapies, including non-EMDR, like some SE or IFS? But I just want to, I'm getting at what's specific to EMDR and what does it share conceptually and in premises with other modalities. So is that a general assumption in trauma therapy? And then would organic intelligence agree with that?
I don't know if that's a general assumption in
Okay.
therapy.
It's at least true of EMDR though. There's an
Yeah,
unprocessed.
and in my own experience of having memories like that and having EMDR help,
No.
those memories, that explanation did seem to fit what was happening.
Right.
And
And
and my therapist used lots of different modalities to help what was happening. So probably those other modalities are similar thinkers, or my therapist was, and he just took from what he needed. And
thank you. Um, in the moment, part of me is what is planning to ask you about underlying mechanism of EMDR versus OI, which some people will be interested in. And then another part of me is interested in asking you about the experience of your EMDR versus your experience of OI, which I think many people will be interested in also. Let me do at least a little bit of time on the first, even though some people may find it more dry. But so you EMDR, you said it works with, I'm going to be less technical, moving left and right in the brain. And then you had two, you said there was an older conceptualization, which was that does the work, and then a newer conceptualization, which was that allows you to be present while something else gets work. Could you just briefly repeat those and how that differs from how OI approaches the healing?
right.
Yeah,
So
thank you.
with EMDR, you need to, the person who's the client, who has this memory fragment or whatever we want to call it, has to hold that in memory while the bilateral stimulation is happening. So you're bringing as much as you can tolerate easily, if there is such a thing, into memory. And then you do some EMDR, and then you see what's the memory look like now. And you kind of hold that in mind, and there's more processing with the bilateral stimulation. And then what's what's it look like now? So you keep following, at least when I did it, you kept following where the brain had settled. So I think that's probably similar to how OI works, because OI tries to follow the nervous system and work where the nervous system is working already. But EMDR brings the nervous system up and says, okay, we're going to work on this today. And OI says, oh, what are you working on today? I'd really like to help if you'd like a little bit of help. So the nervous system might have a list of 15 things, and it's working on them in order because that order makes the most sense and will take the least effort overall to get all 15 things fixed or healed or whatever you want to say. Whereas EMDR and many modalities depend on the insight, intelligence, idea of the therapist or the client. What do you want to work on today? Let's work on that one thing that keeps bothering me. Maybe that's on the list that the nervous system would get to easily with OI as number 15. But in EMDR, it's like, all right, we're going to take number 15 and put it up here right front and center. So it's still effective, but it's not done in the gentlest order that would result in the most widespread healing, like
Okay.
OI does.
In EMDR, do you have to have a memory associated with the symptoms for it to be motivated to work? Or what if you just have symptoms,
I,
nightmares, panic, but you don't have a memory of anything specific?
many of my symptoms were only emotions, panic, terror.
And
So
EMDR works with that.
hold that in mind as much, the little bit that you can, not the emotion.
Okay.
And then EMDR helps the brain process that. So in
Yeah.
any piece of the trauma, whether it's disconnected, like a sharp flash of terror out of nowhere and what's going on, I'm like, or whether it's, oh, I remember at this birthday party, if the memory fragment's not finished processing, or the nervous system hasn't been able to get enough stability since the trauma happened to process it, depending on EMDR or OI's viewpoint, then it's not fully connected in the regular, normal memory way. It doesn't come with the date and the time and the people who were present and the smells and the sounds. It comes with 5 of the 15 things the brain remembered, disconnected from all the other ones. Did that help?
No, yes, yes. If you're reading my facial expression and my pause, it's because I was debating whether to bring something up. So, which I'm just gonna go for it, just on the fly, vulnerability. So, in a prior live stream with Rena, I shared that I once received a death threat. There's context for that, which was rather alarming, and I basically orientation got me out. I mean, I went to the cops for the physical logistics of let's deal with this death threat, or I just looked at a plant, or I oriented. I did what people criticize OI for being super simplistic and how can you just look around the room and everything gets resolved, but it's true if you understand it. Anyway, so orientation to pleasure. Oh, this plant looks cool in the cop's office. So I got through the death threat, and then I did an OI session, which is just orientation and pleasure. So that's how I got through the death threat. Now, how might EMDR approach it?
Can I tell a little bit about what I see going on below the surface with your audience?
Yes. No, free associate, free associate.
Yeah,
Yeah.
I think that the orientation and pleasure takes the conscious part of you and gives it something to just pay attention to without having to worry about it. No effort involved. And so the unconscious system has more resources and can do more healing. And the whole person, the part that the unconscious is sitting inside, is this conscious part, is less wired and anxious because they're like looking around the room and thinking about the flowers or whatever. So the whole system is calmer. The rhythms are calmer. The conscious part of us isn't asking for, oh, I have to think about this and I have to pay attention to that. And the unconscious part, the nervous system, has more space to do its work.
This is here's a question coming from instinct. You have a young child. Your child gets attacked by a dog, and it was very frightening. And you have two choices, and I'm just going to enforce this on you. You have two choices: take your kid to an EMDR person, or take your kid to Disneyland. Can you deliberate about free associate on that, on my confronting you with that?
Sure. Well, my instinct would be to take the kid to Disneyland.
How dare you? Why?
Because the brain hasn't had a chance to finish processing all those pieces yet. And maybe at Disneyland, where there's lots of orientation because there's so many fun things to look at and so much fun stuff to do, and you just kind of have to hang out and be there, the nervous system is going to get a lot of chance to work.
very much in line. What you answered was completely logically consistent and in line with what you just said, which was when you wanted to reflect on the underlying mechanism under orientation and pleasure. When you're doing orientation and pleasure, then you're allowing your biology to do what it needs to do to heal, and it already knows how to do that.
Right.
And that's something you've emphasized. Go ahead.
Yeah, and in a traumatic situation, many times the nervous system, the brain, hasn't had a chance to process all those pieces and tuck them away neatly, like the birthday party memory. That was good.
Hmm.
And so if it has more time, maybe everything settles down all by itself. If the child keeps having problems and, a month later or 2 weeks later, I don't know. I'm not a therapist. I can't say what the timeline might be, but I would go for Disneyland first, as long as the child wanted to.
Yes. I feel like I may be getting a little bit off topic with EMDR specifically, but my my mind is still on the death threat topic that I talked about with Rena, and even if I'm going off topic, maybe I have to apologize, but it feels relevant. So
Okay, do it.
in the aftermath of that, I um my main organic intelligence coach was not immediately available, so I just reached out to another organic intelligence person, and it was not helpful. So I just wanted to share this. So when I talked about receiving the death threat, um, people may be wondering why is Bach getting death? When you have controversy, when you're a controversial person and you have controversial views, sometimes you get death threats. I'll just leave it there. So
Yeah.
so I was talking about it. I was in alarm, and she was um she had a lot of emotions and fear, and she was in her eyes were wide open, and she put her hands on her heart, and you could see like she was afraid, and that was not helpful to me. Not
Right.
helpful.
She was,
I mean,
she
it was
was
just
being a mirror to maybe what
yeah,
your system was putting out, but you were trying not to go there.
yeah. So it was just it was. I mean, I'm not blaming or shaming. I'm criticizing her just in an intellectual
Oh,
sense. I'm not.
yeah, and it's
But
and
it
it's
was not so. In an organic intelligence session proper, it would be joining. So if the joining in the vulnerability of that is helpful, supportive, yes. But at the same time, if it's not, if it's just alarming me more to see you in alarm because I might be killed, then let's process and aim for anything that's less painful, less uncomfortable. So orientation and pleasure
Mhm.
are simple things and deep things and complex things. Could be Disneyland, teacups, churros, a walk around, Mickey Mouse photographs. It could be deep attunement in talking about a death threat and panic, but finding whatever is less uncomfortable instead of the coach not having the capacity for orientation and pleasure, but losing orientation and pleasure, and then I'm just what am I supposed to what am I doing? Yeah, okay. That was just a little
Right.
share on the crucial importance of orientation and pleasure in the coach to promote in the client and in normal life, Disneyland churros, and in according to organic intelligence, all of healing and growth and therapy, but just orientation, pleasure. We're going forward in the future, organic intelligence is going to be criticized for being super simplistic or superficial, but we're holding to that ground because we understand the importance and value of orientation and pleasure. Yeah.
Right. Well, and OI understands the intelligence of the unconscious system
Hmm.
because it's saying we're going to let the unconscious system handle it. It knows what it's doing.
Now, thank you. Now, can I get more to the topic of EMDR? And could you
Sure.
talk about choose your trauma, a
Hmm.
death threat thing, if you want to imagine what that might be like, or a child getting attacked by a dog, or any trauma? What specifically would an EMDR session look like? Yeah.
Well, I hear that these days they're a little bit different.
Hmm.
So I'll describe what I've learned about for these days. The therapist works with the client to get them in a very stable place. And then the client brings up whatever little piece of the memory they want to work on, not the whole thing. It's there's a lot of safety attempt built in so that the whole memory doesn't come blowing out and the person doesn't get re-traumatized.
May I interrupt you? I'm sorry. If I feel like I want to interrupt,
No,
when you say
please,
memory,
anytime.
thank you. When you say memory, I think of an actual memory of a traumatic event, but then you said it may not be a memory. So do you include just pure memories of I'm having symptoms, but not attached to a specific life event? It just could
Yeah,
be,
I'm thinking of like if the child's attacked by the dog, they might remember the fear. They might remember black fur. They might remember it was on the lawn. They
hmm,
might remember somebody over there was screaming. They might remember the sound of the growling. So take one of those pieces.
okay.
It's not like let's bring the memory into our brain in all its glory.
Could just be a symptom
Right.
as
It could
opposed
be
to,
a
okay.
symptom, or it could be the dog was a Boston Terrier, or
But the child may not even know or remember that he was attacked by a dog, right? It could be just a symptom, like, okay, please
okay.
continue.
So yeah, EMDR. I don't even know if it's possible to work with a small child,
Oh,
but it might be
okay.
because you could, let's play tappy, and
Hmm.
then you're getting the bilateral stimulation. Um, but having so if it's a child who's grown to the age of reason, at least, like I don't know, 6 or 8 or 10, if they can bring a piece of the memory and just hold it, like that fur, and then there's the bilateral stimulation for a certain period of time, not too long, maybe 30 seconds, maybe a minute, and I'm going off my memory 20 years ago. And then the bilateral stimulation stops and the therapist checks in. How you doing? What's going on now in that memory? Has anything changed? Do you see more of this or that? And there's a small interchange, and the therapist says, okay, hold that piece in mind. And then there's more bilateral stimulation. So I think perhaps what's happening is that some of the memories coming into active space,
Hmm.
getting that stabilizing pattern and the time for the brain to integrate. And it shifts a little because some's getting integrated. So then there's another part that's come into active space, and there's the stimulation to process it, and it shifts and it shifts, and the whole session won't be like that. Much of the session will be let's make sure we're in a safe place and in a stable place and not feeling panicked, and then after the EMDR, kind of calming down if necessary, because an attempt is made that memory doesn't flash and throw the person into a panic, but it's just small. But sometimes it gets out of hand. And so then there's calming down and smoothing over again.
What are the protocols in EMDR for getting the client stable before, during, or after?
That I don't know.
Hmm.
It probably depends on each therapist's preference and what they've learned works well with their client.
It's it sounds like it would be top down though. Like we're going to
Oh,
instruct,
yeah,
let's do stabilization. Now let's do tiny bit of pain. Now let's do check in. Now let's do stabilization. Tiny bit of pain, check
right,
in. Like rinse,
right.
repeat. Kind of okay.
Yeah, it really is.
Whereas organic intelligence is saying, if you want to go to Disneyland, go to Disneyland. I mean, follow that, trust that impulse for orientation.
Right. And in the session, if you don't feel like thinking about anything, let's just shoot the breeze or just sit and look around the room. That's
Right.
perfectly fine because that gives the system, the unconscious part of the system, a break and it gets more done. Because sometimes we're so focused on do that we don't have any downtime. And so our unconscious system, it gets behind.
Hmm. Go to Disneyland if you feel like it, and then if it's not doing it, and you want to pursue some kind of healing modality, according to organic intelligence, better that it be pleasurable and oriented.
Right.
Yeah.
Right. And the one big thing as far as typical trauma therapy goes, there's always a risk of getting a little bit re-traumatized or a lot. When you're taking out a memory and talking about it, it can get overwhelming and you can go away feeling worse.
Right.
And in OI, it's always the focus is always on let's get the system calm. Let's give you a calm place so your system can start growing and take care of these things behind the scenes.
Yes. And the implementation of orientation and pleasure in OI sessions can be nuanced and tricky. For example, if someone comes to me fresh from death threat or dog attack or just feeling pain, let's just say death threat. I could see a session where they come in and they orient and they want to talk about their favorite pizza. They want to talk about pizza. I could see a session being the entire 50 minutes is on pizza and his favorite pizzas, and we didn't talk about the presumptive topic of the intensity of the death threat. It's just pizza. Why would that be healing? Because orientation and pleasure, and so. Or I could also see the session looking like there's talk of pizza, and if I sense that the talk of pizza involves inhibition of over threshold intensity that's not sustainable, then I might ping, okay, you were just confronted with a threat on your life. But for the reason of deactivating intensity, still under the umbrella of orientation and pleasure. So not only talking about pizza, but also confronting, look, how about we face reality and there's a threat on your life. But as part of orientation and pleasure, and the pizza talk would not be regarded as the less important stuff. It's just as important because we're following orientation and pleasure. So it's
Right.
not just, oh, you're avoiding, you're not doing or that's just pure stabilization. You're not doing the real work. It's orientation and pleasure, which can look like what therapists might criticize us as avoiding, but it's really healing because the client is
Yes.
in pleasure and orientation and talking about the explicit content to the degree that supports modulation of intensity and orientation and pleasure.
Right. And there's another thing that's going on during orientation and pleasure and during the relationship between the client and the coach in OI. And that is that the coach's nervous system is very likely more stable than the client's. And
Right.
those rhythms come through our speech and our movements, and we may even sense them remotely. I don't know how that works.
Hmm.
But the client being in the presence of that stabilizing rhythm, while they're not paying attention to much, that's adding to their orientation because there's a sense of their system that's picking that up, even if it's not a conscious sense.
You're exposing yourself to orientation and pleasure, not pain.
Yes.
In yourself, in the coach, in the dyadic relationship. Um, we're on our time. Was okay. How many sessions roughly of EMDR did you have?
Maybe 50.
Overall, uh,
That was
uh,
spread over 20 years
okay. Two
of weekly.
questions.
I mean, I was doing weekly sessions. It's just that it
Right,
wasn't
right.
EMDR for this whole period.
Um, a few questions. If you have answers, if you can't answer, that's fine. But uh, do you think they helped? If so, how much? And then were they how pleasurable, painful, a mix, very painful, not too painful?
Very helpful.
Very helpful.
Not usually, wow, that really did something, but small shifts over time.
Hmm.
More than anything else, sometimes they were boring. Okay, let's watch the light, left, right, left, right.
Hmm.
And sometimes the memory would grow more and be more painful, and then it'd be like, oh, I feel like I took a step back.
Since we're on time, one more. Why organic intelligence over EMDR for you?
I don't, I can't say there's no risk because who knows what somebody might step in. Like, but with organic intelligence, we're not going to the negative memories and trying our best to keep them in check.
Hmm.
We're letting the system bring them up when it's ready. And then we're also keeping the memory in a stable realm by distracting the client with something else, or how about those Dodgers, or
Yeah. If
like
if
that.
if even the memory needs to come up, it could be that the kid
Right,
goes through physical motions in Disneyland that quote unquote reconsolidate whatever.
right. That bring that memory state back because they're so similar to what happened, and it was a happy experience in Disneyland, and so that led to the dog experience dissolving.
Yes. There's a dog. What's the dog character in the Disney characters? Uh
Goofy,
Goofy, maybe? Goofy.
the
Goofy.
orange dog,
Yes,
because
maybe.
yeah, since the 50s or so.
He hangs out with Goofy or he dances with Goofy and that resolves it. Um, okay, thank you. Last word, any final words for us, Lisa, before we break for the next one?
No, thank
Okay,
you.
perfect. Thank you everyone, and we'll see